I'm Dr. Singh. How can I address you?
Hi, Dr. Singh. You can call me Steve.
Yes, Steve. So from this time, I can see that from last 6 months, you have been having some shortness of breath and chest pain on exertion.
That's correct, yes. I'm actually a 52-year-old smoker. I have been facing these issues, for the last 6 months, as you said. And I'm really worried about the pain. My father has died of heart attack at the age of 53. And now I'm at 52. So I'm really worried that I'm going to have similar kind of problem.
I can see your stress. I'm very sorry about your father. I just want to ask, do you have any pain right now?
Well, not at the moment. I do get pain only, when I walk up, on the hill close to my home. And whenever I walk up, with my dog, close to my home, I feel, a chest pain which is very heavy, central and discomfort. But it used to occur very rarely in the past. But for the last, 6 months, it has been happening quite often.
Okay.
Once I take rest, for a few minutes, the pain settles down.
Can you grade your pain from 1 to 10?
Well, actually, when I walk along the hill, the rating would be about, say, 7 to 8 out of 10.
And does your pain go anywhere else, toward your left arm, towards your jaw?
Yeah, I mean, like my pain actually radiates to the shoulder. And then it radiates to some extent, towards the jaw as well. Yeah.
Okay, I can see. So from above history, what I'm suspecting, you might be having a condition which is called angina.
Okay.
Okay, have you heard about this term before?
No, could you please explain that?
Yeah. So this is heart, and heart has its own blood supply.
Yeah.
And what happened in this condition, there is a narrowing of the blood vessels in the heart,
Okay.
which decreases blood supply to the heart,
Yeah.
and which decreases oxygen to the heart.
That's very bad.
And that's why when oxygen levels decrease in the heart muscle, then you get this pain in the heart.
Oh my God.
Okay.
So is it the first stage of the heart attack or?
Yes. So condition you are having, it is called stable angina.
Okay.
So stable mean it doesn't happen at rest. It
Okay.
happens with the activity.
Okay.
It happens with the activity. Okay.
So how can it be prevented? Can
yes.
I do some kind of exercises so that I can prevent it or?
Yeah, please don't worry. I'm going to discuss what can we do for this condition.
Yep.
Okay, first thing is I would like to do some investigations.
Yep.
I would like to do glucose level,
Yes.
exclude diabetes.
Yes.
I would like to do cholesterol levels.
Yep.
It is fat levels in your body.
Yep.
Then I would like to do. I would like to check your BP,
Yep.
and I would like to refer you to specialist urgently.
Okay. Yep.
Okay, and what he will do? He will do ECG.
Yep.
He will do some test. He will make you to run on some machine,
Yep.
and then he will he will note the activity on the machine.
Okay.
Okay,
Yep.
and in meantime, you have to avoid any heavy activity or any strenuous activity.
Yeah. Okay.
Okay,
Good.
because it will put stress on your heart, and it may your condition get worse.
Okay. I understand.
Okay, are you any questions till now?
No, I don't have any questions.
Okay,
But can I do some kind of mild activities?
yes, you can walk, but try to avoid any heavy activity like lifting any heavy thing or
Okay.
running.
Okay.
Okay,
Yeah.
so I would like to talk about the smoking. Okay,
Yep.
so smoking is one of major factor which precipitate this condition. So I would like to recommend you to stop smoking.
That's very bad. See, I have already started, quitting the smoking, but unfortunately, I'm not able to do it. I have attempted several times, but I'm unable to do that.
So what was the condition, or what was the problem?
Well, actually, I usually, stop smoking for a week, but after that, I get, irritated. I get, mental, kind of stigma, with which, I've been forced to, smoke at least one cigarette after that, So I was not able to, like stop it for a period of, say 1 month or 2 months or so on. I can only, I was able to stop only for about a week, but I was shivering actually. I can't control my nervous system. I was shivering, and I feel really irritated and agitated as well. So
Please don't worry, I can see.
yeah.
And this is a normal thing if someone have been smoking for a long time,
Yeah.
and these symptoms are called withdrawal symptoms.
Yeah.
And when you try to stop smoking like suddenly, then these symptoms appears. So I will guide you how to stop smoking.
Sounds good. Yep.
And first, I would like to talk about the supportive things. Uh, okay.
Yep.
So first thing is you need to go for complete abstinence.
Okay. So
It
what
means like you have to target for the complete stopping of smoking.
okay.
Okay, and you can involve your family. You can tell them that I'm going to stop smoking, and they will encourage you. They will help you during all this time.
Yep.
Okay, and uh, you need to drink a lot of water and take citrus food. So
Okay.
these things help in reducing craving.
Yep.
Okay,
Yep.
and so I'm going to talk about the medication.
Yep.
So the common method which we do which we do during the like smoking cessation is nicotine tablets
Okay.
or nicotine chewing gums.
Okay.
So you can take at least 10 to 15 gum per day
Okay. Good.
if you feel craving,
Okay.
and you need to decrease intake of gum with the time.
Okay. All
Okay,
right.
and this is one of like a popular method for a first line of treatment or for the smoking cessation.
Yep.
And if it is not working, then we have other methods like injection or implants under the skin,
Yep.
or some other medications which
Yep.
will be given by a specialist.
Okay.
Okay,
Yep.
and so do you have any other questions?
No, I don't have any other questions at the moment.
Oh, okay. So I will summarize what we need to do. Uh, as we are having chest pain from last couple of months, also I'm suspecting that you might have angina. So I'm going to refer you to specialist, and he will do some blood investigations or some other investigations, and uh, uh, then and you need to follow the things which I told you regarding smoking cessation, and I will give you reading material regarding the smoking cessation program, and so thank you.
Thank you. Hello, everyone. I'm going to now give the feedback that is going to be word by word for this student, Dr. Singh. So this is going to help you guys out a lot, because you're going to understand what the assessment criteria is all about and what kinds of mistakes did the candidate commit during the role play card. So the first one is the candidate didn't greet the patient. So Dr. Singh should have started by saying, "Hello, good morning. How can I address you?" But he didn't do that. That's a first mistake. Okay, remember that in every role play card, you as a healthcare professional needs to greet the patient. The next one is the candidate started by saying so unnecessarily. So it's not needed at all, right? The third one is the candidate also told from last 6 months. This is incorrect. He must have used for the last 6 months instead of from last 6 months. And then he also repeated last 6 months twice. He should have avoided this. He also told, "I just want to ask, do you have any pain right now?" This is incorrect. The correct sentence structure would be, "I would like to know if you have any pain right now." That's it. Simple. Keep it simple. All right. The next one is, "Can you grade your pain from 1 to 10? This is not good. He must have used, formal words such as, could you please grade your pain on the pain scale of 1 to 10? This is the correct one. It is always important that we use formal words during the role play cards in the OET examinations. The next one is condition called, which is called angina. That is incorrect. That is condition called angina. That's correct. You don't need to use condition called and then which is called. They don't make sense. All right. The candidate also pronounced the word angina incorrectly. He didn't pronounce the words correctly. Okay. So he has said angina. So he should have told angina. All right. The next one is he has used, which twice in one sentence itself. That makes harder for the patient to understand the information. So it's better to say, instead of saying which decreases blood supply in the heart and which decreases oxygen levels, it's not correct. He should have used which decreases blood supply to the heart. This eventually decreases the oxygen levels. That could be the correct answer, isn't it? So please do not use the WH question too many times in one sentence, since it prevents the patient from understanding it correctly. All right. The next one is So the candidate used some background noises quite frequently. They need to be avoided. The next one is he said it happened with the activity. However, he corrected it, but he shouldn't have even committed this. Remember that the third party singular nouns such as he, she, and it always need a verb plus s only in the present tense. So it means it happens with the activity. That's the correct way to answer this question. What would be the next one? Let's say, so the next one is what can we do? What can we do? So this is what told by the candidate. Instead of that, he should have told what we can do is to, that could be correct. Okay. The next one is I would like to do glucose level. All right. It is incorrect because he needs to say, I would like to measure the glucose level. That is the correct one, because you can't use, to do something. Now it's not the one. You're going to measure something, isn't it? You're going to assess, you're going to evaluate something. All right. Also, glucose is mispronounced. He said glucose. It's wrong. It's actually glucose. Okay. All right. The next one is I would like to do cholesterol levels. That's also incorrect. The reason is that we need to say I would like to measure cholesterol levels. All right. You need to use appropriate forms of words whenever you have to represent the information. Okay, let's go to the next one. I would like to refer you to specialist. That is incorrect. Whenever you need to speak about a professional, you need to use an article beforehand. You need to say, I would like to refer you to a specialist. Okay, I would like to refer you to a physiotherapist. I would like to refer you to a dentist. I would like to refer you to a nurse. This is how you need to use. All right. You need to use one of these articles first. When you represent the same person, once again, you need to use the. You might have used a or an in the first instance, but whenever you have to indicate the same person, once again, you got to use the in front of them. Say, for example, I would like to refer you to a specialist. The specialist will undertake a range of tests in order to help you out. That's the correct answer. Okay, good. Let's go to the next one. What he will do ECG. This is incorrect. He needs to say he will perform ECG. That's good. If he wishes, he can expand this word. It's always important to expand, the abbreviations, electrocardiogram. All right, good. In meantime, that is incorrect. You have to say in the meanwhile, okay, at the same time, or in the meanwhile. All right. Background noises were frequently committed by the student, which need to be avoided. Your condition get worse. That is incorrect. Well, your condition comes under the third party singular noun called the it, and as a result we have to use verb plus yes. So the correct one is your condition gets worse. That's the correct way of telling the sentence. All right, let's go to the next one. Are you any questions till now? No, that is incorrect. She should have started by saying, do you have any questions now? And then he repeated, try to once again. See, giving false starts is going to decrease your score under the pronunciation. It helps the patient to understand the information inappropriately. So it's really important that you provide the information once only. You start a sentence and finish it before you go back to the subject and then talk about it again in a new sentence. I would like to talk you about, no, that's incorrect. I would like to talk to you about, that's the correct one. Smoking is one of the major factors. Smoking is one of major factor. That is wrong. You need to say smoking is one of the major factors. Remember that after one of or one among, we always need a plural noun. I don't know why many students commit this mistake by using a plural, a singular noun with one of. We have to use always a plural noun after one of. So it's going to be one of my patients, one of the students, one of the candidates, one of the professionals, and so on. Okay. So the next one is what was the condition or what was the problem? So this is incorrect. He could have simply asked, like, why were you unable to quit smoking previously? Simple. So simple things are always helpful, isn't it? All right, let's go to the next one. He said this is normal thing. That's wrong. He needs to use an article here. He should say this is a normal thing. Okay, let's go to the next one. These symptoms appears. That is incorrect. Why? Because these symptoms is a plural noun and they need only verb after them, which means you have to say these symptoms appear. That's the correct way of saying, isn't it? That's right. Let's go to the next one. Which we. So he has given false starts here as well, and he needs to avoid the same. Good. Let's go to the next one. This is this one of a popular method. That's wrong. He should have told this is a popular method or this is one of the popular methods. All right, let's go to the next one. Given by specialist. That's again incorrect. He should have said given by the specialist. The reason is that we have already used a in front of the specialist, isn't it? Right. And then he started saying this sentence. As you are having chest pain from last couple of months, so you must have angina. That's wrong. The reason is that whenever you use as, it is going to replace so. All right, so you need to use either this or that. They are like enemies. Okay, so we can say, as you have been experiencing chest pain for the last 6 months, I suspect that you may have angina. All right, that's the correct one. Okay, no worries. I hope this speaking assessment useful to you. And if you need a free speaking assessment for your OET mock test, I would be very happy to conduct a speaking mock test with you guys, and I'm able to assess your speaking word by word. I have got a lot of role play cards, and I'm happy to offer you the free assessment for the first mock test. Okay, and I'm also glad to assess your first OET letter word by word, which means every word that you write is going to be assessed against the examination criteria. So to achieve this free assessment, all you need to do is to drop an email at steve@ucanenglishtutoring.com or send me a message at +61 468 480 877. This contains both the WhatsApp and the mobile number. You can also subscribe my YouTube channel, like and share my videos as well if you find the techniques useful. If you have any comments to improve the quality of my videos, please do write them down in the comment section. If you like my Facebook page, that is www.facebook.com/UCAN you will get regular updates on recent examination questions, techniques and tricks on OET, PTE, and IELTS examinations. Thank you for watching this video, and I wish you good luck with your examination.